cool? Can you see me? Can I wear them? You tell me, okay? Hi friends. I'm getting some brisk, fresh air. It is gorgeous today. I had a Zoom meeting with my therapist this morning, and I've just been kind of reflective today. Sorry if it's windy. I bet it's windy. There are people sledding. So fun. So yeah, I was talking to my therapist today, and in some regards, the past year has drug on day by excruciating day, and on the other hand, I feel like it's flown by. And we have a list of goals that we're working on, and I felt frustrated that a lot of them haven't been accomplished, and a lot of alcoholics have mental health concerns as well, and I thought it would be important to address mental health and alcoholism. For me, they definitely can go hand in hand, but I try to make sure that I treat them separately, and that they don't bleed into each other too much, and that's hard. I have a sponsor, and there is literature I read, and I talk to other alcoholics about recovery specific things, and I talk to my therapist more regarding mental health and specific behaviors, and my depression and anxiety, and how those affect relationships. And how certain reactions from other people make me feel a certain type of way, and how I could possibly replace those feelings or replace my reactions with ones that are more positive. And it really just got me thinking that if everyone saw a therapist, the world would be so much kinder. And we would treat each other with more respect. We would care how our actions affected other people. And this is all my opinion. I'm just sort of still reflecting on my therapy session and enjoying the winter wonderland.
I kind of just wanted to check in since today's video is kind of a patchwork quilt, if you will. Some of my ramblings and thoughts and random videos related to mental health and alcoholism, and I think that is a very important topic to discuss here. So I wanted to just kind of run down some of the things that I focus on when dealing with mental health, and specifically mental health wellness. Number one thing that sort of helps me stay on track and pulls me out of a funk is to stick to a routine. So that is even when I don't want to get out of bed, even when I would rather, not change my clothes. I get out of bed in the morning, I make my bed, I shower, I eat something for breakfast, even if it's one piece of toast or a little oatmeal, just to kind of get the body moving. And I stretch a little bit in the morning. So sometimes even the smallest thing, a lot of times when I'm in the shower, and I woke up kind of in that funk, the shower seems to pull me right out of it. So stick to a routine, do those things on a daily basis, even if you don't want to. I know it's hard, but you've got to stick to it. Number two is a diet. Not a diet like trying to lose weight diet, but trying not to eat terrible foods, trying to stay away from sugar and artificial sweeteners and those things that almost kind of give you a high and then you crash from, because when you crash from those things, it seems like the funk is even that much worse. So I'm not saying that like I eat organic or that I cook these great meals every day, but I certainly try to buy some fruits and vegetables each week, some chicken, some red meat. I try to eat a balanced diet. Number three is talking to my therapist on a regular basis. The counseling and talking through situations and talking through problems really, really helps. My mental state, she can sometimes kind of talk some sense into me. And with that relationship with a therapist also comes, medication and being able to diagnose any mental health issues that you may have, and also prescribing any medication that will sort of curb the symptoms and make life a little easier for you. And lastly is exercise. And last, I saved it for last for a reason. This is one that I really am not good at. I don't really exercise at all. I'm not one to, get very physical and work up a sweat, but I at least try to get outside once or twice a day. I take Dash on a walk. I at least get my body moving a little bit. I try to get some fresh air and sunshine. Now, if you're one to do cardio and you like to go to the gym and a good workout sort of clears your mind, amazing. All the better, but I'm just not that type of person. So I at least try to get my body moving a few times a day, and like I said, get some fresh air and sunshine. This sort of is just the tip of the iceberg with mental health and addiction. I'm going to kind of continue this series throughout my channel, so definitely stay tuned for more videos on mental health wellness, and addiction. And as always, I so appreciate the support. Thank you so much for the click. Until I see you again, try your best not to drink and be good to yourself. Bye, friends.